12 signs of pancreatic cancer you should never ignore. Pancreatic cancer is one of the deadliest cancers because it's often caught too late. But what if you could spot the warning signs before it's too late? This stealth characteristic makes pancreatic cancer one of the deadliest forms of cancer, with survival rates that lag behind many other cancers. By the time most people receive a diagnosis, the cancer has often spread beyond the pancreas, limiting treatment options and outcomes. Pancreatic cancer isn't completely silent. Your body sends subtle warning signs that are easy to overlook or mistake for minor issues. Recognizing them early is crucial, as early detection greatly improves survival rates. Having one or more of these symptoms doesn't necessarily mean you have pancreatic cancer, but recognizing them and seeing a doctor promptly could save your life. Here are 12 signs to discuss with your healthcare provider, especially if they persist or occur together. Early awareness can make all the difference. Today, we're revealing 12 silent symptoms your body might be showing, and why ignoring them could be dangerous. Let's dive in. Disclaimer: if you're experiencing concerning symptoms, please consult with a healthcare professional for proper evaluation. This information is educational and not a substitute for medical advice. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Jaundice. Jaundice appears as a yellow discoloration of your skin and the whites of your eyes. This occurs when bilirubin, a yellowish pigment produced during the normal breakdown of red blood cells, accumulates in your bloodstream. Normally, bilirubin travels through your liver and exits your body through bile ducts. When a pancreatic tumor grows in the head of the pancreas, it can compress or block the common bile duct. This duct carries bile from your liver and gallbladder to your small intestine. The blockage prevents bilirubin from being eliminated, causing it to build up in your blood and tissues. Jaundice brings additional symptoms that are equally important to recognize. Your urine may turn dark brown or tea-colored because excess bilirubin is being filtered through your kidneys. Your stools might become pale or clay-colored since bile, which gives stool its brown color, cannot reach your intestines. Many people with jaundice from pancreatic cancer experience intense itching. This pruritus occurs because bile salts deposit under your skin. The itching can be severe enough to disrupt sleep and daily activities, and it often appears before the yellowing becomes visible. According to the Danish registry study, jaundice typically appears later in the symptom timeline, often within weeks of diagnosis. This means the tumor has grown large enough to cause significant obstruction. Approximately 50% of pancreatic cancer patients develop jaundice at some point during their illness. If you notice yellow discoloration of your skin or eyes, seek immediate medical attention. Jaundice always requires investigation, as it indicates a serious disruption in your liver or biliary system, whether from cancer or other conditions requiring treatment. 2. Unexplained weight loss. Losing 10 pounds or more without trying should always raise concern. In pancreatic cancer, this weight loss occurs through multiple mechanisms that collectively drain your body's resources. This isn't the gradual weight change that comes with aging or minor lifestyle shifts. The pancreas produces digestive enzymes including lipase, amylase, and protease. These enzymes break down fats, carbohydrates, and proteins in your small intestine. When cancer disrupts normal pancreatic function, your body cannot properly digest food, leading to malabsorption of nutrients. Cancer cells are metabolically aggressive, consuming enormous amounts of glucose and nutrients. This phenomenon, called cancer cachexia, involves the release of inflammatory cytokines that alter your metabolism. Your body begins breaking down muscle and fat stores to fuel both normal cells and the growing tumor. Research from the Q Research database study found that weight loss occurred in a significant percentage of patients up to a year before diagnosis. The study noted that when weight loss appeared alongside other symptoms like abdominal pain or new onset diabetes, the likelihood of pancreatic cancer increased substantially. The weight loss often accelerates as the cancer progresses. Patients report losing 5 to 10% of their body weight over 6 months without dietary changes. This differs from intentional weight loss because it continues despite adequate caloric intake. Your body may also produce less insulin if cancer affects the insulin-producing cells in your pancreas. This insulin deficiency prevents glucose from entering cells efficiently, leading to muscle wasting and fat loss. The combination of malabsorption, cancer metabolism, and hormonal changes creates a perfect storm for rapid weight loss. 3. Abdominal pain. Abdominal pain from pancreatic cancer typically manifests as a dull, persistent ache in your upper abdomen. The pain settles in the epigastric region, the area just below your sternum and above your belly button. This discomfort differs from the sharp, cramping pain associated with digestive upset. As tumors grow, they physically press against surrounding structures including nerves, blood vessels, and other organs. The celiac plexus, a major nerve bundle located near the pancreas, frequently becomes compressed. When cancer cells invade this nerve network, they trigger a deep, gnawing pain that many patients describe as boring or drilling. The pain often radiates to your back, particularly in the mid-back region between your shoulder blades. This referred pain occurs because the pancreas and spinal nerves share neural pathways. Approximately 70% of patients with pancreatic cancer experience some degree of abdominal or back pain during their illness. The Danish registry study revealed that pain was one of the earliest documented symptoms in medical records. Clinical notes mention pain complaints months before more specific symptoms appeared. This finding suggests that persistent upper abdominal discomfort deserves thorough investigation, especially in individuals over 50. The pain may worsen after eating, as your pancreas normally increases enzyme production during digestion. When cancer disrupts this process, the resulting inflammation and pressure intensify discomfort. Some patients find that leaning forward or curling into a fetal position provides temporary relief. Unlike pain from muscle strain or simple indigestion, pancreatic cancer pain persists for weeks or months. Over-the-counter pain relievers provide minimal relief, and the discomfort progressively worsens as the tumor grows. 4. New onset diabetes. A sudden diabetes diagnosis in individuals over 50 has emerged as a critical warning sign for pancreatic cancer. The Pancreatic Cancer Action Network's Early Detection Initiative specifically investigates this connection. Researchers estimate that up to 1% of people diagnosed with diabetes after age 50 will develop pancreatic cancer within 3 years. Your pancreas contains clusters of cells called islets of Langerhans. Beta cells within these islets produce insulin, the hormone that allows glucose to enter your cells for energy. When cancer develops in the pancreas, it can damage or destroy these insulin-producing cells, leading to diabetes. The mechanism differs from typical type 2 diabetes. Rather than developing insulin resistance over years, cancer causes an acute disruption in insulin production. Blood sugar levels rise rapidly because insufficient insulin is available to process glucose. Patients may experience classic diabetes symptoms including excessive thirst, frequent urination, and blurred vision. Research shows that pancreatic tumors also secrete substances called adrenomedullin and other peptides that interfere with insulin function in distant tissues. This creates a state of insulin resistance even before beta cells are destroyed. The combination of reduced insulin production and increased insulin resistance creates a perfect storm for diabetes. The Early Detection Initiative is working to develop screening protocols for new-onset diabetics. By identifying high-risk individuals early, doctors might detect pancreatic cancer when tumors are still small and potentially resectable. Current research examines biomarkers in blood samples that could distinguish cancer-related diabetes from standard type 2 diabetes. If you're over 50 and suddenly develop diabetes without typical risk factors like obesity or family history, discuss pancreatic cancer screening with your physician. 5. Back pain. Back pain from pancreatic cancer possesses distinct characteristics that differentiate it from common muscular strain. The pain typically localizes to your mid-back, in the thoracic spine region between your shoulder blades. This location corresponds to the retroperitoneal position of the pancreas against the posterior abdominal wall. Tumors growing in the body or tail of the pancreas more commonly cause back pain than tumors in the head. As cancer cells proliferate, they can directly invade the splanchnic nerves and celiac plexus. These nerve structures transmit pain signals from your abdominal organs to your spinal cord and brain. The pain often intensifies when lying flat on your back. Many patients report that they can only sleep sitting up or in a reclined position. This positional component occurs because lying supine allows the tumor to press more directly against the spine and surrounding nerve tissue. Unlike mechanical back pain that improves with rest, pancreatic cancer pain remains constant or worsens over time. Physical therapy, stretching, and typical back pain treatments provide no relief. The pain may feel deep and penetrating rather than superficial or muscle-related. Research indicates that approximately 25% of pancreatic cancer patients present with back pain as an initial symptom. The Danish registry study found that back pain appeared in clinical notes several months before diagnosis in many cases. However, because back pain is so common in the general population, it rarely triggers immediate cancer investigation. The key distinguishing factor is persistence without clear cause. If you experience unexplained mid-back pain that doesn't respond to usual treatments and worsens over weeks, particularly if you're over 55, request comprehensive evaluation. 6. Blood clots. Blood clots represent an unexpected but significant manifestation of pancreatic cancer. Deep vein thrombosis, a blood clot forming in deep veins typically in your legs, can be the first indication of an underlying malignancy. This phenomenon is called Trousseau syndrome, named after the physician who first described the cancer-clot connection in 1865. Cancer cells release substances that activate your clotting system. They produce tissue factor, mucins, and other procoagulant materials that tip your blood toward excessive clotting. Pancreatic cancer specifically releases high levels of these substances, making it one of the cancers most strongly associated with thrombosis. A DVT in your leg causes swelling, pain, warmth, and redness, typically in your calf or thigh. The affected leg may feel heavy or tender to touch. The danger arises when clots break free and travel to your lungs, causing a potentially fatal pulmonary embolism. Research published in the Journal of Thrombosis and Hemostasis found that patients with unprovoked venous thromboembolism had a significantly elevated cancer risk in the following year. Pancreatic cancer appeared among the most common malignancies detected through this presentation. The study estimated that 4 to 10% of patients with unprovoked blood clots have an underlying cancer. The clotting tendency can also manifest as superficial thrombophlebitis, inflammation, and clotting in surface veins. These clots may migrate, appearing in different locations over time, a pattern called migratory thrombophlebitis. This migration pattern is particularly suggestive of malignancy. If you develop a blood clot without obvious risk factors like recent surgery, prolonged immobility, or known clotting disorders, your physician should consider cancer screening as part of your evaluation. 7. Fatigue. Cancer-related fatigue transcends normal tiredness from busy schedules or poor sleep. This exhaustion penetrates deeply, affecting your physical, emotional, and cognitive functioning. Patients describe feeling drained of all energy, as though their batteries can never fully recharge. Multiple factors contribute to this overwhelming fatigue in pancreatic cancer. Anemia frequently develops as tumors bleed microscopically or disrupt normal red blood cell production. Fewer red blood cells mean less oxygen delivery to your tissues, leaving you perpetually breathless and exhausted. The metabolic demands of cancer create an energy crisis in your body. Tumor cells divide rapidly, consuming vast quantities of glucose and nutrients that your normal cells need. Inflammatory cytokines released by both cancer cells and your immune system further disrupt energy metabolism and promote feelings of sickness and exhaustion. Poor nutrition from malabsorption compounds the problem. When your pancreas cannot produce adequate digestive enzymes, your body fails to extract sufficient calories and nutrients from food. This malnutrition state deprives your cells of fuel, perpetuating the cycle of exhaustion. The Q Research Database study identified fatigue as one of the 23 symptoms significantly associated with pancreatic cancer. Researchers found that fatigue often appeared months before diagnosis, sometimes in combination with weight loss and digestive complaints. This symptom cluster should prompt thorough medical investigation. Sleep disturbances from pain, anxiety, and metabolic changes further worsen fatigue. Many patients report that despite sleeping longer hours, they wake feeling completely unrefreshed. This non-restorative sleep compounds daytime exhaustion. Cancer-related fatigue doesn't improve with rest or sleep. If you experience persistent, overwhelming tiredness lasting several weeks that interferes with daily activities, discuss this with your healthcare provider rather than dismissing it as stress or aging. 8. Digestive issues. Digestive problems in pancreatic cancer manifest in various ways, all stemming from disrupted pancreatic function. Indigestion, medically termed dyspepsia, creates a burning or uncomfortable feeling in your upper abdomen. This differs from heartburn, though the two often occur together. Your pancreas normally secretes enzymes through the pancreatic duct into your duodenum, the first section of your small intestine. These enzymes include trypsin and chymotrypsin for protein digestion, lipase for fats, and amylase for carbohydrates. When tumors block the pancreatic duct or destroy enzyme-producing cells, these digestive processes fail. Nausea becomes problematic as your stomach struggles to empty properly. Tumors can compress the outlet of your stomach, called the pylorus, creating a partial obstruction. Food sits longer in your stomach, triggering nausea and sometimes vomiting. The vomiting may contain undigested food eaten hours earlier. Early satiety, feeling full after eating very little, results from both stomach compression and altered hormone signaling. Pancreatic tumors can affect the release of gastrointestinal hormones that regulate appetite and satiety. Patients report feeling uncomfortably full after just a few bites of food. The Danish registry study found that gastrointestinal symptoms like heartburn and indigestion appeared in medical records significantly earlier than classic pancreatic cancer symptoms. These complaints were often documented 6 to 12 months before diagnosis. Unfortunately, because these symptoms are extremely common in the general population, they rarely prompt cancer investigation initially. When digestive issues persist despite treatment with antacids or acid-suppressing medications, further investigation becomes necessary. The combination of indigestion, nausea, and early satiety, especially with weight loss, should raise suspicion for pancreatic or other gastrointestinal malignancies. 9. Changes in stool. Stool changes provide visible evidence of pancreatic dysfunction. Steatorrhea, the medical term for fatty stools, occurs when inadequate lipase prevents proper fat digestion. Undigested fats pass through your intestinal tract and appear in your stool. These stools look pale, greasy, or oily. They often float because of their high fat content, whereas normal stools typically sink. The appearance has been described as clay-colored or putty-like. The stools may be difficult to flush, leaving an oily residue in the toilet bowl. The odor of steatorrhea is distinctively foul and different from normal stool odor. This occurs because intestinal bacteria ferment the undigested fats, creating particularly malodorous compounds. Patients often report embarrassment about the smell, which air fresheners cannot adequately mask. Diarrhea frequently accompanies steatorrhea as your intestines try to expel the poorly digested food. The loose, frequent stools may contain visible oil droplets. Some patients experience urgent bowel movements, needing to rush to the bathroom shortly after eating. Conversely, some people develop constipation when tumors partially obstruct the intestinal tract. The pressure from growing tumors can affect intestinal motility and slow the passage of stool. This constipation may alternate with diarrhea, creating an unpredictable bowel pattern. Research has shown that stool-based biomarker tests may eventually aid in pancreatic cancer detection. Scientists are investigating whether tumor DNA or specific bacterial signatures in stool samples could identify cancer early. These non-invasive screening methods could revolutionize early detection if they prove sufficiently accurate. Any persistent change in stool consistency, color, or frequency lasting more than 2 weeks deserves medical evaluation, particularly when accompanied by other concerning symptoms. 10. Loss of appetite. Appetite loss, or anorexia in medical terminology, represents a complex symptom with multiple underlying mechanisms in pancreatic cancer. This differs from occasional disinterest in food that everyone experiences. Cancer-related appetite loss is persistent and profound, with food becoming completely unappealing. Tumors alter your body's production of appetite-regulating hormones. Ghrelin, the hormone that stimulates hunger, decreases in cancer patients. Simultaneously, levels of leptin and other satiety hormones remain elevated, creating a persistent feeling of fullness. This hormonal imbalance effectively shuts down your natural hunger signals. Inflammatory cytokines released by tumors and your immune response directly affect the hypothalamus, your brain's appetite control center. Substances like tumor necrosis factor alpha and interleukin, 6. Suppress appetite at the neurological level. Your brain receives signals that your body is full even when you desperately need nutrients. Taste and smell changes frequently accompany appetite loss. Foods may taste metallic, bitter, or simply bland. Previous favorite foods become completely unappetizing. These alterations occur because cancer affects sensory nerves and changes saliva composition. The psychological impact of cancer diagnosis and the stress response further diminish appetite. Anxiety and depression, common in cancer patients, independently reduce food intake. The combination of physical, hormonal, and psychological factors creates a powerful barrier to eating. The Q Research study found that appetite loss appeared significantly more frequently in pancreatic cancer patients than in controls, often months before diagnosis. When combined with weight loss and abdominal discomfort, appetite loss should prompt immediate medical investigation. Persistent appetite loss leads to malnutrition and accelerates weight loss. If food becomes unappetizing for more than 2 weeks and you're losing weight, discuss this symptom with your physician immediately. 11. Abdominal mass. An abdominal mass develops when a pancreatic tumor grows large enough to be palpable through the abdominal wall. This typically indicates advanced disease, as the pancreas sits deep in your abdomen, surrounded by other organs. Small tumors remain undetectable by physical examination alone. During a physical exam, your physician presses systematically across your abdomen, feeling for abnormal lumps or masses. A pancreatic tumor might be felt as a firm, irregular mass in your upper abdomen. The mass is typically non-tender, though the surrounding area may be uncomfortable due to inflammation. The detectability of an abdominal mass depends on tumor location and your body habitus. Tumors in the body or tail of the pancreas must grow larger before becoming palpable compared to tumors in the head. Individuals with less abdominal fat allow easier detection of masses. Sometimes the mass represents not the tumor itself, but secondary effects. An enlarged pancreas from ductal obstruction may be palpable. Occasionally, metastatic disease to the liver creates detectable hepatomegaly, an enlarged liver with a firm, irregular edge. Imaging studies provide much more sensitive detection than physical examination. CT scans, MRI, and endoscopic ultrasound can identify pancreatic tumors as small as 1 centimeter. These technologies visualize the relationship between tumors and surrounding blood vessels, information critical for determining resectability. Research indicates that only about 20% of pancreatic cancers are resectable at diagnosis. By the time a mass becomes palpable during physical examination, the cancer has usually grown substantially and may have metastasized. This underscores the importance of recognizing earlier, more subtle symptoms. If your physician detects an abdominal mass during routine examination, immediate imaging studies are necessary to characterize the finding and determine appropriate next steps. 12. Enlarged gallbladder or liver. An enlarged gallbladder occurs when tumors in the pancreatic head obstruct the common bile duct. This duct serves as the drainage pathway for both liver bile and gallbladder bile into your intestine. When blocked, bile backs up into the gallbladder, causing it to distend. Courvoisier's sign refers to a painless, palpable gallbladder in the presence of jaundice. This clinical finding suggests malignant obstruction rather than gallstones. Gallstone-related obstruction typically causes a scarred, non-distensible gallbladder, while cancer obstruction allows the gallbladder to expand. During physical examination, an enlarged gallbladder may be felt as a smooth, rounded mass below the right rib cage. It descends when you take a deep breath, moving with the diaphragm. The finding is more readily detected through ultrasound or CT imaging than physical examination. Liver enlargement, or hepatomegaly, develops through multiple mechanisms. Bile duct obstruction causes the liver to swell with retained bile. More concerning is hepatic metastasis, where cancer cells spread from the pancreas to the liver through the bloodstream or lymphatic system. An enlarged liver feels firm and extends below the right rib cage where it's normally tucked under the rib cage. The edge may feel smooth in bile obstruction, but nodular or irregular with metastatic disease. Imaging studies can differentiate between simple enlargement and metastatic involvement. Research shows that approximately 50% of pancreatic cancer patients have liver metastases at diagnosis. The liver is the most common site of metastatic spread due to the direct venous drainage from the pancreas to the liver through the portal vein. Ultrasound serves as an excellent initial imaging test when physicians detect gallbladder or liver enlargement, providing real-time visualization of these organs and any obvious tumors. Subscribe to the Human Health YouTube channel for more insights. If you found this content helpful, please like, share, and comment below.